Okay, so we need you to stop. And let's see here, we have STDs. Oh, crotch rot. So, little do you know, or maybe you do, because I've said it millions of times, that cervical cancer is directly related to one STD. Which STD is that? HPV. Cervix is way high up in your coochie. So if you had a dress and strapped that brother up, he would have never got to your cervix with his little HPV having penis. But no, you wanted to do all your thing with Tom, Dick, Harry, Sue, Jane, and Mary, and no raincoat. This is why we have a lot of what we have right now. Right now, STDs are rapidly increasing. They are 40 times higher than just 20 years ago. You and your little Tinder app. You and your little, what's the latest one, y'all? What's the boo thing? What is the app for the boyfriend, girlfriend thing? It was, the people on the west side told me what it was. I forgot already.
Bumble?
What is it called, baby?
Is it Bumble? It's like the same thing as Tinder, but the girls like.
What is it?
It's called Bumble. It's like
Bumble, there's a word.
It's like the same thing as Tinder, but the girls have to initiate the conversation.
Isn't that precious? So you're just so independent. You're initiating your little sexual conversation. That's lovely. Listen, crazy people.
Oh, it was Plenty of Fish.
Oh, that's what it was. Because it didn't sound like Bumblehead. It was Plenty of Fish. You won't smell like fish when you get done with Plenty of Fish. So you and your little coochie problem. Y'all keep on. Let me know how that work out. So, look, y'all, I can't say it no better. Condoms actually work for this cervical cancer exposure. It won't stop everything. I had a delightful, sweet, precious patient who made sure it was her goal to be a virgin when she married, and indeed she was. And she married into this HPV. Caused her to have outright cancer, caused her to have no other children other than the few I delivered for her because we had to do such massive surgery on her cervix. She didn't have the cervix to hold them. And she wanted 5 kids. We could narrow that down. Changed her whole life. She was a virgin when she got married. She did it all right. That's why the vaccine matters, isn't it? Because maybe you did do it all right, so-called all right, right? Maybe you did hold weight, save yourself for your man. And your man had HPV. It's not like you would have known. It's not like we tested him for it. We don't, and we usually can't. So what did you do? You married a great guy. He's a sweetheart, by the way, one of the nicest men I know. But when he came into this marriage, he came after having at least 20 partners. By the way, that's average for a man, and for the woman, 11 is average. Want to keep on playing with this? Let me know how it worked for you. Okay? Next on the list is a low vitamin D. I have yelled and fussed and cussed and bothered y'all for I don't know how long to go get your vitamin D checked. Now, if you ain't got the shit checked by now, when you get your insurance, you will. And then if you have insurance, you have no excuse for not getting it checked. Do not underestimate the ability of vitamin D to protect you from a lot of diseases, in particular infection and autoimmune and some cancers. Because a low vitamin D prevents your body from recognizing foreign substances and cancers. And so you don't activate your immune system at all because you didn't recognize it as different from self. That is what vitamin D does. It helps you recognize something other than self. Okay, and if it's something other than self, it's supposed to attack it, but it didn't recognize it, so it didn't. It also helps with your bones, right guys? So we all know that you can't use calcium unless you absorb vitamin D. Okay, babies, number 10, inadequate vaccination. This is where we're specifically speaking, of course, about the HPV vaccine. There has been a dramatic drop in cervical cancer since the initiation of this vaccine program. It used to be 3 shots. You have to know it's only 2 now. It used to be just for girls. It's for girls and boys now. It used to be for just 4 types of HPV. It is now a variation of different coverage with the shots. So do your homework before your children get their shots, or before you or whatever get your shots. I remember when it came out, I was just so shocked that this was out, because it was right after I had diagnosed that precious patient that I'm speaking about with advanced cervical cancer. And it was right after we had chewed her cervix up one side and down the other. She barely had any left. And she said, and I quote, "God damn it, why wasn't it out before I got married? I would have got that. Please, Shelly, tell them my story. Let them know if I had just had access to that vaccine, I would be able to have the 5, the 6, the 8 children that I've always wanted." That was her message to you. Okay, so we know that this virgin got married to somebody whose strain of HPV attacked her and attacked her wildly. Now, why did it attack her so viciously? Because every time you get pregnant, it makes everything grow. And every pregnancy that she got, she made sure she had one right after the other because she wanted so many, and she was young and healthy. And every pregnancy that she got, that cancer grew even worse. Estrogen makes everything grow. Okay, so just remember that these vaccines that are available, you may want to do your homework. Don't be mad at your patient if they don't want any of them. We talked about this in toe-to-toe. There is a fear of vaccines out there, and even though the research shows that this is probably very, very safe, all the vaccines we currently have, I understand the fear in the sense that we've said things were safe before and they turned out not to be. So patients have a fear. What you need to do is just offer them the objective information in writing, as well as your respectable self telling what you know, what you've researched. And here's the thing, you can't really speak on it unless you did your own research. So you look like a nut if you don't really do the research, right? You're just whistling Dixie as a company song. But I need you to stay conscientious and educated about what the hell vaccines are and which ones really work and what's going on with that one and how long has that been out and how many people did they test it on. That is an educated person, okay? So you're gonna just kind of love your patient, explain to them, hey, I get it, I respect your decision. Don't ever be angry at a patient for not taking your vaccines because we have been wrong before. And so it's only reasonable that they're thinking through what they're doing with their children. Their children matter and their children are everything. So they don't want to, you don't want to judge. I see so much judging on this issue. Let it go, please. When do you judge? What's it called on the test? Paternalism, right? It's called paternalism. Doctor knows best crap. Okay? Just know that we should have a healthy conversation and we should educate our patients about what's available and what's able to be used by them. Okay? Now, these were modifiable, the ones I gave you. Let's talk non-modifiable, shall we? You can't do shit about your old age. I mean, your young age. I'm old, baby. There's a few of us in the place, been there, done that, t-shirt, sunrise, in our first rodeo. The older we get, the less years we have in front, the more we left behind, and we are now at risk for a lot of shit, right guys? Now, the only thing we can't say that about is testicular cancer, right? Because it's a young cancer, huh? It's under 25, even under 35 for the guy. But everything else, just get yourself together, okay? So that's age, heredity. Uh-oh. Genetics is no joke, y'all. Peep this. Ovarian, breast, endometrial, colon. And now they find out some, not all, pancreas. These cancers, and I would keep the 4 at the top in mind because that's the latest, that's been the longest knowing fact forever. Those 4, ovarian, breast, uterine, and colon, we all know that those are hereditary. In other words, we have a gene for that. We have captured the BRCA gene for that. A positive BRCA gene, and I do want you to spell it right, a positive BRCA gene will put you at risk for every single one of those. BRCA looks like breast cancer because that was the first cancer we associated with that gene. But actually, if you have a positive BRCA gene, you're at risk for ovarian, colon, breast, endometrial, and now we know pancreatic. But the 4 at the top are huge. Those 4 at the top are huge. Okay? So those are your genetic cancers. All right? So that's that, huh? So you can change a little bit of this and a little bit of that, get your life together. Now, even though these are risk factors for cancer, it's been my experience that students mess up 3 terms. They mess up warning signs, which are not risk factors. They mess up signs and symptoms, which are not risk factors. They just mix them up. I'm sure I did it too. I ask you one thing, you give me the other, right? So be careful with this. The warning signs are on a page in your packet. So open it up, turn to it. I gave you a lot of them, you guys. And what I did, I tried to give you like 2 or 3 pages to write stuff on, but my favorite one is this one because it's easy to write between each line. So this one is thebomb.com. Even though the same damn thing is behind it. But I prefer this. So turn to this one. You can write later stuff on there, okay, if you want or whatever, but you can read it. Now, let's go. Chop, chop. First of all, at the very top of your page, like I did, put diagnosis equals biopsy. So that's what's here. DX equals BX. DX equals BX. Diagnosis equals biopsy. My baby's sick. I hate that. You are my baby, even though I fuss. Oh, God, I love that girl. Okay, so your diagnosis equals biopsy, and here's the fun thing. We are starting to get really good at something called liquid biopsies. What's that? Blood test. It's just a blood test. Isn't that great?
I just made a middle ground.
No, it just really is starting. We're getting really good at it, you guys. You're not going to be cutting on people. We're just going to draw their blood and see the DNA of their cancer, right? You just would not believe the things happening in cancer. It's a big deal. So know that term. Write it down. Liquid biopsy equals blood. Looking for DNA in the blood. That's how this. That's how the leukemias and stuff are going to be diagnosed soon. You know, leukemias and lymphomas. They call those liquid cancers, by the way. Okay, so anyway, that's kind of cool. Now, let's look at our warning signs. Every single one of these on the board, I've had the misfortune of having a patient with. And it was very subtle. Okay? So what I need you to know is that these are so subtle. They're so subtle that you might miss it, and your patient damn sure ain't paying no attention. They're not paying any attention at all. Okay? So let's look at change in bowel and bladder. Change in bowel and bladder could be anything that's not your norm. So literally, if you don't get constipated and you are, cancer warning sign. Literally, if you don't have loose stools and you just started, cancer warning sign. Literally, if you have melena, what the hell is that? Tarry stools, black tarry stools, blood, right, baby? If you have melena and you didn't, that's a cancer warning sign. If you had bright red bleeding and you never did, that's a cancer warning. I mean, you know this. But then the bladder, the worst, and I say this all the time, and maybe you should put it at the top of the page. Most cancers are painless. Painless hematuria should scare the shit out of you. Painless hematuria should scare the crap out of you. Painless hematuria can be bladder, renal, or prostate cancer. Painless hematuria, bladder, renal, or prostate cancer. Now, I'll tell you something. Men are interesting. They're stoic. Remember that word? Mm-hmm. Well, they get this hematuria, and it can be brown, bright red, whatever. And because it does not hurt, they keep it moving. Mm-hmm. They really do not look this as at this and say it's something big. And unless you're, and I'm just not that wife. Unless you're in the bathroom with them, although he always teases, we share everything. No, we're not sharing the bathroom. I can't bring myself to that point, brother. I'm not that girl. Okay, so unless you share the bathroom with your dude and watch him piss, which I can't and won't. I just get to thinking how much is spraying all over everywhere, and then I get disgusted. So then, unless you're watching your man go, you're not in there with him knowing that this is painless red urine. Y'all, please understand that half the cancers we die from is just because we never went to check the shit out the first time we seen it. Prostate cancer and colon cancer shouldn't kill anybody in America, but nobody goes to get this shit checked out. They just kind of hope it goes away, and the fact that it's painless makes them think it's going to go away. Okay, so I need you to know, talk to your wonderful brother, talk to your uncles, talk to your dads, talk to your sweethearts, your little flavor of the month. You ain't going to say shit to him, but I'm just saying the ones you married to and whatever you're doing. Okay, say something to a brother because they don't have to die from this. They really don't. Okay, all right, that's that. Now, I want to say something about this change in bowel. More than likely, if it's a colon cancer, that change in bowel is a late sign. That I will give you. Painless hematuria might be an early sign of some stuff, but the change in bowel is usually a late sign. What I need my babies to remember is that anemia in anyone 35 and up is colon cancer until proven that it's not, especially men. Anemia in anyone 35 and older is colon cancer until proven that it's not, especially men. I already gave you reasons why ladies could be anemic. We could be doing the fibroid thing or something like that. But we talking about some men, they should not be anemic. Every last one of those men with any kind of anemia need a colonoscopy yesterday. And I cannot tell you how many times I've seen this, and they told me nobody worked it up. One was in my class, it was her husband. She went all the way through nursing school with him being told take iron and getting hematological studies, and then he was getting an iron infusion, all this old bullshit. And no one did a colonoscopy. And when they did, it was lights out. He died when she was in my class. So, yeah, she's very upset about it. But she heard me talk about it in class. She said, wait a minute. So how do you know that? Like, how come nobody knows that? Because we've been to like 3 doctors, hematology and everything else. I said, well, it's not that I know this. It's what all of us do. This is how we practice. This is what we all do. If it's my doctor, your doctor, they all should be on the same page. It's not special study knowledge. It's everything we were taught. Every last one of us were taught this in med school. So it's not like special. It's like, what else could it be? And that goes back to where I taught you when I did anemia, that you must fix it. It should not continue to linger. What caused it? It's not even a diagnosis, is it? It's a sign or symptom of a problem. It's not a diagnosis to say, oh, girl, I've been anemic all my life. What I tell you, it's not eye color. Something caused it. Now fix it, okay? Be real strict about that, okay? Next is a lesion that does not heal. This can be a wart or a lesion, a bump, some kind of thing. Here's what I like my babies to know, because a lesion, a wound, an incision, a bump or whatever it is, and I'm going to say that again because it's important. A lesion, a wound, an incision, a pressure ulcer injury, whatever it is, should have healed up by 4 weeks. I had nurses sitting on pressure ulcers for 2 years. Wake up. It's not working, whatever you're doing. All of those things should have healed within 4 weeks. So why is it still there? So I had one of y'all, you know how y'all do the sidewalk consult. So let me grab it because you get paranoid after the cancer lecture. Let me talk to you for a minute. Let me talk to you about the sidewalk consult. I'm asking her for a copay by the time we done because she done got too much going on. So we in the little room in there, and she said, let me show you something. So she showed me her back and her arms, and she wear long sleeves, and she showed me all this here stuff. I said, I said, what's wrong with me? I said, girl, you need a hemoglobin A1C. Yeah, because it's been here for, what's that? She said. I said, that's a test for diabetes. Oh, I thought it was cancer because you was talking about lesions and sores and shit that don't. No, no, I don't think it's that. But I do think that you're right. It should have healed and it should be lingering. Her hemoglobin A1C was 11. So she's fine now. She's very comical, actually. Remember that time I pulled you and said I thought I had cancer? Yeah, I remember. Okay, so it ain't always cancer, but it should have healed. What do you know about diabetes? Slow healing wounds. What else does it? Steroids. But this particular patient just needed to know that she was a diabetic. Okay? All right, so a lesion that does not heal should have healed in 4 weeks. Unexplained weight loss, fever, bleeding, or discharge. Uh-oh. Weight loss, huh? Let me just tell you something about that weight loss. Where is sugar stored? In our fat cells. So what does cancer thrive on? Sugar. So you can't even eat enough sugar to please cancer. Because when it's advanced and it's spread all over your body, which is what weight loss usually dictates, and that's what makes it so fucking sad, because if I do have a patient that's lost an incredible amount of weight, it means that cancer is advanced and aggressive. And when it is, it's going to get the sugar by any means necessary, and you can't eat enough sugar to please this one. So it goes after your fat stores, and what's stored in fat? Sugar. Now you drop in weight. Not a good sign. Not what I want to see. Definitely not what I want to see. Okay, so that's advanced. Okay, but hey, it's one of the #1 signs in pancreatic and colon cancer. The fact that you drop some weight. Ovarian cancer will gain or look like they're gaining weight, but colon and pancreatic will look like they're losing weight. Okay, babies? Fever. Cancer takes a lot of metabolism, if you will. It's going to increase your metabolism. Okay? Now, whenever I say the word metabolism, think hot. So, metabolism and heat always go together. With the fever, it does not go away and it gets worse every evening. So you go back down in the morning, but you come back up in the evening. That's what this fever is all about. And it's not a high-grade fever, just to fuck with you, it's low-grade. That's why it goes on and people don't really pay attention. So we're talking about 100, maybe 101, low-grade. This is lymphoma or leukemia. Low-grade. Lymphoma or leukemia. Okay? You may put with that night sweats or some shit. Chills, maybe. But not all the time. It could just be as simple as that fever. Bleeding or discharge. So bleeding, let's tackle bleeding. I know for a fact that a patient that calls me that has been in menopause for years, and she knows I teach this very well, and I know for a fact that in that patient that has been in menopause for years, if she calls me and tells me she's having some postmenopausal bleeding, that I know I better test her for cancer, and just between you and me, 100% of the patients I've tested have had cancer. That's how serious postmenopausal bleeding is. So you should be talking to your mom, your grandma. They should know that after being in menopause for years, and menopause by definition is no periods for 1 year. So that's the definition. It's a diagnosis in retrospect. Has to be a year. So postmenopausal bleeding is cray-cray. Okay? That's some bullshit right there. And you're going to come in my office with that, I'm doing an endometrial biopsy. Because no doubt it's uterine/endometrial, the same thing, endometrial cancer. And it has been. I've been very glad that I pulled them into office right away and did it. Because it is pretty compelling to have postmenopausal bleeding. Biopsy takes me 2 seconds. I numb your ass up. You don't even feel this shit. Comes back information. Let's take care of this shit now. Okay? Nobody died from it. Not one. Okay? So just get people to know those signs. Warning signs. Okay? All right? Discharge. Oh, by the way, one more bleeding. Make sure you know postcoital bleeding. The hell is that? That's bleeding after intercourse. Maybe spotting, maybe outright bleeding, I don't give a shit. Postcoital bleeding, good enough for me. Come on down. When's your last pap? Let's look it up. Cervical cancer. Postcoital bleeding. So it may be cervical cancer. That is a sign. Okay, the cervix is irritated, right? You keep bumping it and it's irritated. Abnormal discharge could be from anywhere. It has been in men through their nipple, breast cancer. It has been unilaterally in women, unilaterally, very concerning. I remember one of my first patients when I first got out of grad school, a case, and I'd never seen colors like that come out of anybody's breast. It was greenish black. I was like, fuck my life. Okay, it was her first physical in 10 years because she got, insurance. So she said, it's always been there. I'm like, oh, no. And it was pretty advanced breast cancer. So you're not supposed to be having discharge out of your breast that is crazy colors. And if the person, and boy, do you have to write this, if the patient does not have children under 5, it needs a workup. Now, if they got little ones, who cares? You got boob leaking, okay, whatever. I care. I shouldn't say that, right? But I'm going to be less worried. If it's bilateral, less worried. Clear, bilateral, less worried. Child under 5, almost not worried at all. Now, I did have this patient whose child I delivered 13 years prior call me up with this breast nipple discharge crap. Oh, no, honey, come on in. Let's see what that is. So she comes on in. And she tells me, this is what's going on. And I have this protocol I follow to keep my ass out of jail. And so the protocol that I follow that is geared towards saving lives and making sure I never miss a breast cancer ever in my life is that when you call me with a problem, we're going to work it all the way up. You're going to get an ultrasound, a mammogram. You're going to go see the breast specialist. We ain't going to sit on this now. So I told her that because if you do not tell her that up front and you start examining her, then she freaks out and you tell her that, what you think it is? No, first of all, before I even touch you, this is how we're going to do this. I'm very strict with breast cancer. I don't want to ever miss it. So when you came in here and told me this lovely little deal here, I want you to get an ultrasound, a smushogram, a consult with the breast surgeon, all 3. That's my protocol. Do I have an agreement out of you? Okay, Shelly, whatever you say. Oh, okay. Now, so we're going to go ahead and try to examine you. And so when I leave up out of here, go ahead and take your top off, move your bra, and then put the little open to the front side of the little, crop gown on, because we've got the little breast exam gown, right? And I'll be right back in. She's like, okay. So I come right back in. She got a little worried look on her face. I get ready to examine. I said, oh, your crazy ass got barbell piercings on your little girls, huh? That's why your little ass is leaking. Your body thinks you're breastfeeding. You got the barbells. Shake. Every time you put a top on, shake, rattle, and roll. Somebody nurse it. That's what your body thinks. Because any touching, irritation, constant stim, that's a baby. Survival of the fittest. He's geared towards making lives survive. So he thinks, you got a kid up there. She said, for real, for real? I said, well, that's exactly what it is. It's all it is. You got these barbells. I ain't mad, but they're not for me. But you do you. But I'm telling you, that's why you're leaking out of both breasts. Because what do we know? Bilateral leaking is actually not as bad as unilateral complaints, right? Mm. And now that I see your little barbells, like you lifting weights with your boobs, I get it. Okay? Now, she was fine, but it was concerning at first, wasn't it? Because what did I say? I delivered her child 13 years ago. You should not be leaking out of your boobs. Less than 5 years old. Okay? All right, now, the discharge may even be vaginal. It could be that this is some really weird thing going on with you, and you don't know what it is, and so you come in to see me. And a lot of people think like that. STDs will give you a weird discharge. Well, trichomoniasis will. Right? It will give you horrible discharge. But gonorrhea and chlamydia, not necessarily. Remember that gonorrhea and chlamydia are asymptomatic. in women for the most part. So you don't even know you have that. So if you actually call me with this, it may be a cervical cancer or at least precancer lesions. So I try to check and see what's going on. So what do we got so far? Nipple discharge, vaginal or cervical discharge that does not seem right. Discharge wherever.